Good evening and welcome to the Child Neurology Foundation's 2021 Patient Advocacy Summit. My name is Katie Henches and I'm the Director of Programs for the Child Neurology Foundation. This is our inaugural Transition of Care Patient Advocacy Summit, and we believe that the patient voice and experience is an integral part of a successful transition from pediatric to adult care. This summit focuses on centering those voices and experiences, ensuring that these young adults and those who support them have the knowledge, tools, and confidence to be able to make the process successful. In addition to this summit, CNF offers other resources in the transition of care space, including a toolkit for young adults, their caregivers, and clinicians to begin and encourage the many discussions required for a successful transition to adult care. They are available in both English and Spanish. We will be dropping the link in the chat for you to look at. These resources and our summit would be impossible without our partners. We're able to put on summits like this for free today, thanks to generous support from our partners in transitions of care, including Acadia, Biogen, ASI, Genentech, Greenwich, and Zogenix. We also hope that if this session resonates with you and if you find it helpful, that you make a donation to the Child Neurology Foundation. It's so helpful in continuing our efforts to provide first-class programming and education like this summit. We will be dropping a link in the chat for you to be able to donate if you wish. All right, so on to our panel for tonight. It's entitled Kids Get MS Too, Better Understanding Disease Processes for Better Adult Neurologic Care. And I'm very excited to introduce our three panelists. Dr. Tanusha Chitnis is a professor of neurology at Harvard Medical School and a senior scientist with the Ann Romney Center for Neurologic Diseases, where she created the Translational Neuroimmunology Research Center, studying, among other conditions, multiple sclerosis in children. She's the past chair of the International Pediatric MS Work Group and has authored over 250 publications and reviews related to MS. Hannah Schnitzler is a 19-year-old who received her diagnosis of remitting relapsing MS when she was 15 years old. She's a psychology major at DeSales University in Pennsylvania. Please follow her on Instagram at @Hannah_and_MS. We also have Dr. Ann Tilton, who's a professor of neurology and pediatrics and section chair of child neurology at Louisiana State Health Science Center in New Orleans. She studies neurohabilitation, neuromuscular disorders, and clinical applications and research in novel uses of therapy in the care of children and adults with abnormal tone. She's the co-chair of the Child Neurology Foundation's Transition Project Advisory Committee and has held leadership roles at the American Academy of Neurology, the Child Neurology Society, and the American Society of Neurorehabilitation. Our moderator for this panel is Jennifer Pizzuto. Jennifer is an outpatient therapist with youth advocate programs in Pittsburgh and a board member for community and living support services. She's an advocate for people with MS, working with patient advocacy groups like MS World, and is the director of MS Insight. So before we get into their comments, I want to go over a few housekeeping things. This panel is being recorded and the recording will be made available to all registrants in the password protected hub you received access to upon registration. Please remain muted while the panelists are speaking, but there will be designated time for you to unmute yourselves and ask questions of the panelists at the end if you wish. Please indicate that you have a question when you're prompted to do so with the raise hand button in the reactions section at the bottom of your Zoom screen. We also welcome you to ask questions or provide comments at any time by using the chat feature. If you feel comfortable doing so, please turn on your camera. We would love to see you, but we understand if you have a distracting background, feel free to leave it off. So with that, opening comments, I would like to pass it over to Jennifer.
Thank you very much. So thank you everyone for joining us tonight. We're going to start with some questions for our panelists. We're going to start with Dr. Chitnis. Dr. Chitnis, tell us what you're working on these days.
So thank you, Jennifer, for that question. I am very involved in pediatric MS, as you know, and I have a clinic at the Massachusetts General Hospital where I see children and young people with MS, as well as other demyelinating disorders. And I'm working on a clinical trial, actually several clinical trials. We've just finished one called the Terry Kids clinical trial, and that has been presented. And there's several other clinical trials which are on their way to being started. And I can't reveal all of the new treatments that will be studied, but these will be available on our website as well as on the International Pediatric MS Study Group website. IPMSSG.org is a good place to look for clinical trial information on pediatric MS, or also clinicaltrials.gov. So I'm very excited about these trials because they will help to move the needle forward for getting FDA approved treatments for pediatric MS. And we already have one treatment that's been FDA approved for pediatric MS, that's called Gilenya. And now we hope to have others in the near future that will be well studied in robust clinical trials and approved. So that's currently one of the major things that I'm working on.
Okay, thank you so much for that. So just some general questions. As far as MS goes, what are the differences between pediatric MS and adult MS? What are the main things that you see?
Yes, so very good question, Jennifer. So MS in children and teenagers can present a little bit differently than it does in adults. So there's a couple of things which I would say are good news. And one is that children and teenagers, when they have attacks, they recover well from those attacks, sometimes with steroid treatment, but they do tend to recover very well from attacks compared to adults. So that's some good news. I think also in terms of the longer term outcomes, if you look at children 10 years down the road, they tend to have lower rates of walking disability than typical adult patients do 10 years down the road after diagnosis. So those are some pieces of good news. I think the things that I would want patients and families to be aware of, however, are some of the challenging features. One is that pediatric MS is a highly inflammatory disease, and kids can have more frequent relapses than typical adult patients. So if an adult has, on average, say, 1 relapse a year, children and teenagers can have 2 to 3 relapses per year. And that's, again, on average and untreated. So our goal with treatment is to prevent these relapses, because we know that down the road, they can cause disability and problems, especially if they're unchecked and they sort of build up and you have relapse and attack after attack, then it's hard for the body and the brain to recover. So that's one other important feature to notice. And I'd also say that another important fact to be aware of is that MS is challenging to have as a diagnosis in general. And it's even more challenging when you're a young person who's going through school, high school, a lot of stress, a lot of challenges during that time, and to have a diagnosis and a condition where you have to go to doctor's appointments, maybe be on a treatment, and then also have the potential for events or attacks to happen. I know that can be challenging. So I think our young people especially need a lot of support if they have a diagnosis of pediatric MS. And that could be in the clinics in the form of psychologists, family counselors, I think just even families and friends, but also trained professionals who can help them through these challenging times.
Thank you for that. So you kind of touched on this a little bit, but I wanted to ask specifically what some of the benefits, if there are benefits to being diagnosed in childhood years as opposed to adult years, like being on a certain medication for a longer period of time, or getting earlier treatment. So do you have anything to add to that?
Yeah, so I think that in a way, even though it is difficult to be diagnosed at a younger age, I think what we are learning about MS, and there's still evolving data, but we think that the origins of MS actually probably start in the teenage years, in adolescence, probably around age 16 or even earlier in some people. And that's for adults with MS too. And this is through studies where they're extrapolating back, looking at brain MRIs and when lesions might have occurred. So we think that MS probably starts in adolescence. And if you're diagnosed in adolescence and start a treatment in adolescence, then you have a better chance in terms of long-term outcomes than someone who had MS undiagnosed for 10 or 20 years until their 30s, and then were started on treatment later. So in a way, it is a silver lining to a dark cloud, and I think we have to keep that in mind.
Okay, so if you're diagnosed as a child with MS, what does the transition look like into adulthood? Specifically, what does it look like to change neurologists? Are you able to stay with your pediatric neurologist, or would you recommend going to an adult neurologist, like one that deals with mostly adult MS?
Yes, that's a great question, Jennifer, and one that many of my patients face. And this depends in part on the region that you're in, on your hospital, your pediatric practitioner, and your pediatric neurology practice. So in my practice, I tend to transition young people at the age of about 21 or 22, which is a little bit late, but we feel that they benefit from having access to the pediatric specialist, to our pediatric nurse, our family counselor, and just the support that goes on in the pediatric MS clinic as opposed to an adult clinic. Although there's support, it's different types of support, and it is busier in many, many ways. And I think also, some of the transition issues might get lost. So we tend to transition a little bit later. We also realize that college is a challenging time. A lot of young people are transitioning from high school to college, or maybe to a new job, and we want to help them through that period. And then once they're settled in, then we think it's a reasonable time to transition. Now, not all practices will do that, and some might transition patients earlier, and at the age of 18, and that's fairly typical for many pediatric hospitals. So it is a good idea to have that conversation with your pediatric neurologist, your MS specialist, early on, and sometime around the age of 16. It's good to just understand what the next steps would look like, and when that transition would occur. I think also some factors that are helpful with transition are for if there's a transition to a different hospital or a different doctor, to have a joint meeting where both doctors can be present and just do a sort of handoff and make sure that all the documents, all of the records are transferred correctly, and also that everyone feels comfortable about the next steps in treatment and management.
So if I am a young adult, say I'm a young adult, and I think that I have MS, or I suspect that my child has MS, how do we get involved in clinical trials? And also, what's the benefit in doing so?
Yes, so that's a very important question, and I think I'll start with the last question first. And I think there is a great benefit in clinical trials for pediatric MS, as well as many other pediatric conditions. Traditionally, children and teenagers have not been involved in clinical trials until much later on, or even not at all. But what clinical trials do is they give us robust, clear information about dosing, safe doses of medications. They give us efficacy data, so we know how effective it is. So when I'm having a conversation with new patients, I can tell them exactly what the odds are of preventing relapses. It also gives us very clear safety data. So as a doctor, I think that's very important, and being able to share very clear data about the side effect profile of this medication in kids and teenagers specifically. And so those are what clinical trials offer. There are other ways to study medicines, including prospective or retrospective studies, but they don't offer the same quality of data. The other factor is that clinical trials, and especially these large, well-conducted phase 3 trials, can lead to regional approval of medications for the condition, for pediatric MS. And this means that if medicine receives FDA approval, then it is easier to have that medicine paid for by insurance. It's easier to access that medicine because there will be plans and ways for doctors to prescribe it easily without jumping through a lot of loopholes and questions that often arise. And also there will be safety monitoring plans in place for those medications. So those are other reasons why clinical trials are a benefit. Now, how to get involved in clinical trials, I think a couple of ways. I've mentioned, in case you didn't catch it, was to go to clinicaltrials.gov. And that is the government website that hosts and lists clinical trials. Just type in pediatric multiple sclerosis and you'll find all of the trials that are running, and those might be in your area. You can also go to the International Pediatric MS Study Group website, IPMSSG. I'll just say that again, ipmssg.org. And there are listed a number of clinical trials.
Thank you so much for that, Dr. Chinnis. Do you have anything else that you would like to add, or any takeaways that you want for anyone watching this tonight?
I just want to say that we've made a lot of advances in the treatment of MS in children and adolescents over the past 15 years. And this has been the efforts of a number of different groups and people. And I just want to thank all of you out there who've been a part of that effort, families as well, who've helped to move this forward. And I remember when I started to practice about just over 15 years ago in pediatric MS, there were no treatments that were approved or even very, very well studied. And now we have approved treatments. We have a lot of information to help guide us. And I think this is really a benefit for our patients.
Thank you so much for that. And I would like to point out to anyone watching that the links have been posted in the chat. So if you're interested in looking at any of the links that Dr. Chitnis had mentioned, they are all in there. So check that out. Thank you so much for your time, Dr. Chitnis. That was so fantastic, very informative. Thank you so much.
Thank you.
Thank you. Okay, we're going to move on to Hannah. Hannah is actually a patient with pediatric MS. So if you would, Hannah, can you share a little bit of your story with us?
Yeah, so I was diagnosed when I was 15, turning 16, so pretty early. It pretty much caught me off guard. I would usually go on runs around my neighborhood because I like to be active, and I still do. And after one run, I woke up the next morning and my legs were completely numb, and it really caught me off guard. And I started Googling it, and I kind of just got overflooded with information, trying to figure out what it was. I originally thought it was a pinched nerve, and then I was thinking it could be a stroke. And then after going to the ER a few times and my physician and then eventually a neurologist, I came to the conclusion that it was MS. And it was at first very difficult to accept because I was so young. And after looking into it, I was really wondering how I could have gotten the diagnosis after being only 15. But then I came to realize teens can also get it, kids can also get MS as well. So it did catch me off guard, but eventually I did come to terms with it, and I'm glad to say that I'm okay with it now. So it's been a long 4 years, but I'm glad it's happened, ironically.
So what made you feel glad that it happened? Like what was your kind of takeaway from that?
At first I felt like I was a little bit closed off with it, but over time I came to terms with like sharing my story online. I connected with other teenagers with it, and there were times where I have an Instagram account and I post mainly for advocating for MS. I also have a YouTube, which I haven't been as active on because I kind of come into issues with trying to come up with new ideas. But with the Instagram account, I have had people DM me saying that they believe that I'm an inspiration, and it's a nice feeling knowing that I'm helping someone after going through what I went through and then noticing they're going through what I also went through. It's really nice to know that I'm helping them in a sense because they're struggling, but I was also struggling at once too. And I can be someone who they can look forward to talking with in regards to whatever issues they're dealing with their MS and everything.
That is so inspiring. Where do you find support as a young person with MS? Where do you find other people that can kind of understand where you're coming from and empathize with your story?
I feel like it's mainly online. I've been involved with a few in-person events when it comes to MS, but with COVID and everything, it's been a little bit less now. But again, with online and like posting about it, I have people reaching out, which it comes time to time. I'm also involved with a support group for MS as well. They're called the MS Youngsters. It's ran through the National MS Society. They're all from the entire, it's national. There's people from Pennsylvania. There's someone from the UK, It's all throughout America as well in other countries. It's a really great way to kind of talk with other people. And I've also I've had people reach out to me, and I've tried to enlarge the support group because I want other people to have a place to go to when it comes to having MS. Because when I was first diagnosed, I felt a little bit alone, but after opening up online, I feel as though I have more options and more ways to speak up.
That is so awesome and courageous of you to share your story, because I know that's got to be a support to so many people.
Yeah.
So I really give you a lot of credit for that, Hannah. That's awesome. So I want to ask you about the transition from the care that you got for your MS as a teenager, which you're still a teenager, but like transitioning more adult care. So tell us what that transition was like for you, to go to from your first neurologist to transition, to adult care.
I am actually still with my pediatric neurologist at the moment. As Dr. Chitnis was saying, having a conversation with your neurologist about the transition from pediatric to adult, it's something I haven't had like an in-depth conversation with my neurologist, but we've spoken about it once, and I feel as though I don't have to be hesitant about asking her. I will obviously have that conversation with her next time I see her, but I feel as though it's been a nice transition. Like the start of it, at least, it's been pretty smooth.
That's great. So what would you tell other adults, or what would you suggest to other young adults who are struggling to get a diagnosis? Because as you know, there's that gray area sometimes before you're diagnosed where you're wondering what exactly it is that you're dealing with. Like you mentioned, you thought it was a pinched nerve or like a mini stroke. And I had very similar, experiences when I was diagnosed too. So what would you tell somebody who is just struggling to get that MS diagnosis so they can start treatment and just start their recovery?
I would encourage them to push for an answer. When I was going through the entire situation of trying to get diagnosed, I didn't really give up. Me and my mom were really pushing to try to figure out what it was, because after seeing the ER, like going to the ER twice, they didn't really have a definite answer. They seemed very confused, as were we, but we knew it wasn't something as like little as a pinched nerve over time because the numbness was persisting. So I would totally encourage to keep on trying to get an answer, because if there are symptoms that are confusing, that have no explanation, it's obviously not something that you should ignore, and you should try to figure out the situation.
So be an advocate for yourself, and because you kind of know when there's something going on with your body, something that's not right. Sometimes you have to push for an answer with medical professionals. Definitely. And I think that's a really hard thing. So that's really wonderful of you to kind of talk about that and share your experience. Is there anything that you would like to add to all of the wonderful information that you shared with us all tonight? Are there any takeaways that you want people watching to take with them?
I guess just shedding light on the fact that kids and teenagers also get MS. It's really, I'm not really sure how to describe it, because like some people, when they hear that a kid has MS, they might think that they're overreacting, if they're not really, I don't know how to describe it. Considering we're so young, I like to think of myself as someone who is like an old soul almost, because I feel like I've been through a lot after being diagnosed, but just not to take anything for granted, like what we could say, and just to shed light on the fact that it's also kids who get MS as well, not just adults. Sure.
And definitely having a diagnosis like this will aid you for sure and turn you into a soul. So you definitely get some wisdom before your time. Mm-hmm. That's amazing, Hannah. Thank you so much for that. That was extremely inspirational. Thank you so much for sharing your story.
Of course.
Definitely appreciate it. We're going to move now to Dr. Tilton. So Dr. Tilton, if you don't mind, could you please share with us what types of projects you are focusing on currently?
Well, thank you for letting me be here. I had a computer thing, but I'm back. Well, we in the introduction mentioned a little bit about what I'm involved in, and I do see children with MS, and I do for general neurology, but not to the detail that Dr. Chitnis does. My focus is more towards children with disabilities, such as spasticity, dystonia, movement disorders, and obviously some things with MS can even overlap some of this. But I have a great interest in how to manage that, how to, sort of tackle the things that interfere with function for children with disabilities to give them actually their best opportunities to participate and to be part of the community and do what they want to do, meet their goals.
Perfect. That's fantastic. So question for you, and I apologize if this is a little redundant because you did touch on this a little bit, but in the movement disorders world, are there other diseases or disorders that we've traditionally thought of as adult disorders that we see in children?
Well, I think absolutely, and they can be ones that we predominantly think are as an adult, like we can say with Hannah, but there are also some that these individuals have that they are actually transitioning into the adult world, and we've got some education from that standpoint too. Some of the ones that I think about immediately are, there's something called dystonia. You may or may not have come across it before, but it's something in which you have tone and it's quite dramatic and it's sort of a posturing, and it's often confused with spasticity. But we think of it in adults a lot of times where someone has tightness of their necks or other things. And we see dystonia as well, but it may be for a different origin. It may be for another reason, although it could be genetic. It could be a lot of other reasons. And it's sort of that dramatic view, if some of the people in the audience have come across this, where the person, when they're sound asleep, are just, comfortable and loose. And the minute they start being stimulated or take a bath or something and you try to get out of the tub, they're very, very tight and often, difficult to really handle without without concerning you might hurt them or something. We do see other disorders, Parkinson's disease, we see Huntington's disease, and these are ones that are very traditionally thought of as adult. And they are rare, more rare probably than the MS, but we do see that. And there can be things a lot of times like tremor and other things you go, how could a child have that? But we see it, and I think Dr. Chitnish could say definitely, as a general neurologist, that's one of the exciting things about being a neurologist is about, you're always seeing something you wouldn't anticipate, and it's very interesting.
Yes, it is very interesting. So if my child's neurologist isn't recognizing some of the symptoms that I think my child has, and I think my child has a pretty severe diagnosis that's not being diagnosed, how do I advocate for my child's care? Oh, I think you're on mute still. Thank you.
Anyway, you know yourself best as you as an individual, a young adult, and you can say, this just isn't what I would normally feel, or weakness or other things like that. And likewise, as a parent, you're your child's advocate. So going and knocking on doors and saying, I really think this is persistent. Other symptoms that seem vague that really are helpful as a physician to say, this has something we need to delve into immediately, or something like this is progressing, this had a date of onset, and really, how is it changing? Is it just motor? Is it sensory? Is it affecting how someone's thinking? And all of those things are important. Something bring it on, something, is there a time that it's better? And one of the things I think that's part of new technology, relatively new, is if it's something, particularly if it's intermittent, take a picture of it. And I mean like a video, and capture that movement, capture the different things, because some things can be more intermittent, or maybe just for a day or for half a day. And if you can capture it, then you can bring it, and then everyone can take more of a view. Sensory is a little trickier because it's subjective. It's something you feel and we can't feel. However, we have tools and different things to try to look at that more closely.
Yeah, I think your point about taking a video of it so that the neurologist can actually see what's happening is a great one, because there's no fighting with the video. Like, there it is right in front of you. So yes. That's wonderful. That's a wonderful suggestion. to kind of change topics just a little bit, and I asked Dr. Chitnis this question also, but I wanted to give you a crack at it too, because I think it's very important. What are the benefits of enrolling a child in clinical trials?
Well, she mentioned specifics about the MS and those things. And so I was going to step back a little bit. I mean, there are several different types of trials. And some of them are just what we call the epidemiology or just the natural history. And we shouldn't underestimate what that is either, because you can compare it to a course of someone's disorder. And you can also compare if you do an intervention and it doesn't do the usual course. And so those things are incredibly valuable. And we always talk about risk benefit, and that's sort of neutral. There's probably not a whole lot of risk of sharing that information. And the benefit is that you become part of something bigger, which is quite good. And then there are the treatment trials, like she was mentioning. They can be for an intervention that may be a procedure, it may be a medication, it may be an injection, it may be those things. A lot of what I do are the botulinum toxin injections and the pumps and those kind of things. And it's very important and such. You want to know it's safe. And that is one of the pieces of data you get even later in it, to monitor it closely and to see if it helps, to make a difference. You don't want to move forward on something or give someone something that isn't helpful. And it also is closely monitored by the FDA or whomever else to be sure that this is something that will benefit. And being part of that's very important. Plus the personal benefit.
Yeah, absolutely. Thank you for that. Also, so just kind of shifting topics just a little bit too, how would we handle transition of care? Like, say I'm a young adult getting ready to transition my care into adulthood, and I'm symptomatic without a diagnosis. How do we handle that transition of care?
That's difficult. I mean, there's no question. It's difficult when you have a diagnosis, because the communication, which is absolutely critical, can be conveyed in an easier fashion. And if you have difficulties with that diagnosis, then it's even more essential. So it compounds the issues. One thing that I would say as the physician who is transitioning someone is to be sure, and this is helpful anyway, to really put a full summary of that workup, everything that's been done, and that gives you a chance to look it over anyway. And also, as you enter into these times, and I think even before that, an emergency plan. One of the transition tools, and I think Jessica can bring that forward, is that one of those tools is an emergency form. And I really like this form, because what it allows you to do is put the medicines you're on, the side effects if you're not on them, the problems you've had, the whole thing, so that when you go, whether or not it's with an absent diagnosis, is you've got the information that's sort of compiled and in a nutshell, because this next physician is going to have to take on a further diagnostic, as we say here, odyssey, but a diagnostic search for what it's doing, and trying to find someone who will accept that. And a lot of this is on the provider, because they may reach out to someone they work with and say, I have put this work together. If I thought someone might have MS and I don't know it for sure, and it's a diagnosis in recognition or, something like that, then I might call Dr. Chitnis and say, if she was an adult physician, say, look, there are enough symptoms that make me think that this is what's going on. Or if someone's moving to Boston, I'm concerned this might be it. We know that MS is time and space, and we don't have a secure diagnosis yet. Here's everything I have. Can you please take this patient? I will be available. You need something, I will be more than happy to do it. And then what other subspecialists are involved, and you have to link all that up as well. Obviously, a tremendous obligation that someone's taking on because of potentially the gravity of the situation. So lots of communication, not just can't see you anymore and out the door. You gotta be sure that it is not transfer, but it's transition.
Definitely. Yeah, I think that's a key point too. It's not transferred, it's transitioned to give time. So the links that Dr. Tilton mentioned are in the chat. So for anyone who is watching this right now, they're in the chat. So check those links out. Dr. Tilton, is there anything else that you would like to add? Thank you so much for all the great information. Is there anything else that you'd like to add as a takeaway for anyone watching this?
I think that's it. I think hopefully we're all advocates, but there's no better advocate than the individual and the family. And I think we all learned a long time ago that you listen. As physicians, you got to listen.
Absolutely. Absolutely. Well, thank you so much for that. Thank you. So I have some general questions for anyone on the panel. So anyone who would like to answer, please feel free to jump right in. The first question is, what are some ways to increase funding for research in pediatric MS and other traditionally adult disorders in children?
I can start on that question. I think one way is through NIH funding, and how families, how patients, the community can increase NIH funding is to write to your congressperson, your senator, and ask for this condition, pediatric multiple sclerosis in general, to receive more funding because it's an important topic that affects many people in the United States. Another way is through fundraising, and this might be through fundraising for societies that focus on multiple sclerosis, and you might be able to do this with your own family, with your own, with a group maybe if you're in school, you might get others involved. And if it's a walk, if it's a bike ride, then there's ways to not only get yourself involved, but also have others sponsor you and have others participate in these fundraising drives. So those are very important. And one of my first fellowships in multiple sclerosis was sponsored by the National MS Society, and I'm forever grateful for having that start in this field. And so a third way is also through funding through other entities, and really, again, advocating. If you know that there is a group, a company who has funding that they would like to share with a disease entity, then think about the National MS Society, think about other MS-focused organizations for donations.
Okay, that's so great. Thank you so much. Those are great resources. Thank you so much, Dr. Chitnis. Are there other disorders that have been traditionally seen as adult disorders that we now see in children more commonly, or in other specialties?
So I can start, and I'm sure that Dr. Tilton has a number of comments in that area, but I think that one of the factors in the past, say 20 years, is that we have better diagnostic tools for many diseases that are now being used in children. And at least in MS, one of the big diagnostic tools that wasn't available widely 20 or 30 years ago was MRI. And we also have better diagnostic criteria and groups that are getting together and creating or really working through diagnostic criteria for pediatric diseases. So all of those are important advances for diagnosing children and teenagers when they wouldn't have otherwise been diagnosed.
Dr. Tilton, do you have anything to add to that?
Well, I totally agree with what she was saying. I mentioned a moment ago, I guess it goes both ways in terms of moving in, pediatric moving into adult, and adult now recognized earlier in childhood. And maybe interventions earlier will have some more optimistic outcomes in some cases.
Excellent. We have a couple of questions from the chat that I want to pose to the panel. Okay, so the first one is the progression of early onset conditions, which are typically considered adult conditions like MS, Parkinson's, Huntington's, more aggressive than one might see in an adult? Like, are they more aggressive in children than in adults?
Go ahead.
So I can start on that, and again, Dr. Tilton might have some to add, but I think it really depends on the condition, on the disease. And MS is largely a disease of the immune system, which of course attacks the brain. And we know that in young people, the immune system is more active. And so technically, kids are having more attacks, more frequent attacks than adults do. And so you might think of it as a more aggressive disease. There's some good news, again, because kids recover fairly well from those attacks, but yet, again, having attacks can lead to longer-term disability. So the immune system is more active in kids, and that's why we do see some differences in pediatric MS compared to adult MS. Some of the other disorders that were mentioned are what's called neurodegenerative disorders, such as Parkinson, Huntington's. And when those present with forms of, say, movement disorders in young people, it's sometimes not exactly the same disease as in an older adult. And it's partly there's more genes that might be involved in a pediatric onset case of some of those diseases. And so there either might be a higher genetic load, risk factors, or specific genes that have gone awry. So I would treat them slightly differently with that caveat.
Mm-hmm. No, I agree, because part of what I was talking about in terms of Parkinson's are some of the symptoms more than the Parkinsonian type symptom, more than the same disease, which is a bit different. Some of the genetic ones in early onset, as she mentioned, often have maybe a higher burden or load of things that will make that sometimes more difficult. But depends on the disorder considerably.
Okay, thank you so much for that. We're going to go back to the chat because we're getting some wonderful questions. What are your thoughts about decentralized clinical trials, and how might that advance understanding about pediatric neurological conditions as a whole, given the fatigue and downtime young patients often experience?
So I can start on that, and I'm interested in others' comments, and including Hannah, because I think that what we're seeing now, and especially in this past year and a half, is that technology can help us in many ways, and technology, including virtual visits, telehealth, can help reduce the burden of coming to clinical trial visits, which sometimes can be quite often, because we want to monitor patients closely, of course, if they're on a new or a therapeutic drug trial. So it's, I think we should use telehealth and these virtual visits wisely in clinical trials. Of course, it doesn't replace ever seeing the doctor or safety monitoring. There's also a lot of thought and work going into, can some of these visits be done by having a nurse or a clinician come to your home and do some of these visits? So I think we're all thinking about how to make it easier for especially pediatric patients and families who are busy, who are have other things going on, to participate in clinical trials. And these are some of the measures. And I'd be interested in hearing from Hannah if she thinks those would be helpful.
I do think those would be very helpful. I've been involved with a few clinical trials myself, and I can totally say that they are draining from time to time. But for the most part, I feel like that would only be like a certain problem if you did experience fatigue. But however, I do think it would be very helpful for those with MS.
Great. Hannah, I have a question specifically for you from the chat. Do you feel like your friends understand your limits? It's hard to express fatigue and often misunderstood. What advice do you offer a younger person with MS, or a younger Hannah even, about knowing your limits, and how do you explain those limits to your friends?
I feel like my friends understand my limits to an extent. Obviously, they don't have MS themselves, so they can't put themselves in my shoes and can completely see how it is when it comes to fatigue, in my case mainly. But I try my best to explain it to them, like, hey, this is what's going on. I try to be very detailed because I want them to know everything that's going on. That is the advice that I would give another person with MS or a younger version of myself, because it's kind of difficult. Like when you're first getting into the entire diagnosis, you might be hesitant to explain everything because you might not be comfortable yet. But in the case scenario in which you want other people to understand what's going on, you have to try your hardest to voice what issues you're dealing with. And that, in my case, was the most accessible way to have everyone understand what my limits were.
Okay, that is excellent. Let's see, Hannah, there's another question for you. Was there a time from the chat, was there a time that you can pinpoint when you think that you pushed yourself too far and you thought, I can't do that again? Like I just did too much, I overdid it, and I just can't do that anymore.
When I was first diagnosed, the entire thing with the running, and then I believe the run actually that I went on triggered the first symptom of the numbness, which lasted for about 2 months before alleviating. When I was like, I'm still active right now, but I was more so when I was first diagnosed. And after hearing that I had it, I was still trying to stay active because obviously my doctor's encouraged to stay active. It's the healthiest thing to do. I was still going on runs, and this one specific time I was going on a run and my legs became very tingly, and at the time they were still numb. So it was a very weird sensation. I don't do it anymore because it's just uncomfortable for me. I totally wouldn't do it again. I still stay active, but I steer clear from running because I feel as though it kind of affects my body differently compared to how it did before. But I did 100% push myself way too far during that moment.
And that's a tough thing too, is learning, your physical limits and coming to accept that too, especially being so young. That's really difficult.
Yes.
I have another question from the chat, just a general question. How can providers discuss and support transitions for youth with neurological conditions in a way that is engaging, strength-based, and likely to translate into real behavior change? What language, tools, activities, etc., should we be using or not using or creating to meet the needs of younger patients?
I think there's a couple of tools that I use and also that I want my young patients who are transitioning to adult care to focus on. And one is taking responsibility for medical appointment making, for visits, and for keeping on schedule. So that's, I think one, just taking responsibility. And that starts early. It could start before transition. It could start at age 17, 18, not having mom or dad always be the ones who make the appointments, who make sure you get to the appointments, but, have the young person really think about that and be the instigator. So I think that's one major factor. So taking responsibility of your healthcare because it is your health. And I think that's also empowering because it's a young person's health eventually that they will have to take care of in young adulthood. So the other part is also medication compliance or adherence. And that means sticking to your medicine regimen, whether it's a daily pill or whether it's making appointments for your infusions. So that's also critical. So again, that comes down to taking responsibility for making those appointments, if that is the case, but also for reordering your medicine, if it's a pill, and being on top of that. And again, that should not fall on mom or dad, but now start to become part of your responsibility. So I think that transition in terms of responsibility taking can take place earlier than the actual move to adult clinics. And I think that's something that I look for when I'm transitioning a teenager or a young adult, just to make sure that they are participating in their own care.
I'm going to jump in for a second and just sort of as a reminder about the toolkit. And there are some forms in which they ask the parent or they ask the child, do you know how to do this? Including if you have an emergency, who to call, what the number is, all of those things. But, teenagers or young adults are often, I'm independent, but then you've got to be real sure that something this important in medical, all those needs are met too. So having someone take on their own responsibility is I think, very, very important at this point in time, and really does, as you pointed out, move you towards whether you can do it as, successfully as transition. It's clear in the literature that it isn't necessarily MS or neurological illnesses, but people even with transplants, renal or all that, their medical care drops precipitously at the time of transition, just because of a number of factors, including a change in the type of care. Often making those decisions, making the changes is right. And always leave another appointment after they transition to be sure, be it virtual or otherwise, that they're there and that they're fine. So there's always an appointment after the appointment to be very careful about that. So.
Excellent, thank you. So we have time for one last question. So we'll sort of end our Q&A session with this. What would each of you tell a teenager who thinks that he or she is struggling with what they think is a neurological symptom and is working to find a diagnosis? What are some of the most important things to keep in mind if they think that there is something neurologic happening with them?
So I can start. I think it's very important to seek the right type of medical care. So start with your pediatrician. Make sure that your pediatrician understands the types of symptoms that you're having. Sometimes, and again, not to disparage anyone, but these sometimes can be passed off as well. You're fatigued because you just went through exams and it was a busy time, or you fell because you tripped. So I think persisting and really keep coming back to your pediatrician, to your primary care doctor, saying that this is something that seems to be more chronic, as Tana had alluded to. So I think persisting. And then the other is seeking expert care. I think that's also very important with some rare neurological conditions like pediatric MS. And you might start with a general pediatric neurologist, and they might start to run some tests. And then, in the case where if it does turn out to be pediatric MS, I think thinking about seeing a pediatric MS specialist, even for a consult, is a good idea, just to have a good lay of the land in terms of what's available in terms of treatment. What should a monitoring schedule look like? What are other specialists that should be involved in my care? And then it might be possible to go back to a local neurologist who can work with you on that. But I think having that consult is helpful. And there now are many ways to do even virtual consults. So I think we also would thank telehealth and making care more accessible in that way.
For sure. Anybody have anything to add to that?
I feel like when going through the journey of accepting a diagnosis and just getting used to it, an important factor is just to focus on communication. I feel like communication is one of the most important things when it comes to that. Just getting out any questions that you have specifically, because you can never have too many questions, especially when you're going through that entire journey. Yeah, just communication is really, really key.
One thing I always tell parents, and this is, you've been going down this road for a bit, or even the child, after you talk about it the first time, second time, if you remember a fraction of what was said, you're way ahead of the game. There's just so much, it's emotional, there's a lot of information. So when these things pop in your mind, like, oh gosh, why didn't I ask more about something that was said or whatever, write it down. You've got a phone, put it on the phone, whatever, because sure as you go back in there, it's a stressful situation to go to the doctor. And you might not remember. So I think writing the things down and recognizing that your physician wants to answer those questions. And if you remember, and it's okay to ask again, or to say, explain to me again about the immune system, or explain to me again how it's going to come and go and what forms there are. Because Dr. Google's tough. You don't know what you're really hearing when you read that. So you have to be very careful, know your websites, know where you're going, because you will be down a rabbit hole and terrified or something. So always worry about that.
That is a great point. That is a great point. There's a lot of scary stuff out there. So make sure that you know what you're looking at, for sure. Well, thank you. Thank you to everybody. I'm going to hand it back over to Katie now to wrap us up.
Perfect. Thank you so much, Jennifer. And thank you to our panelists, Dr. Chitnis, Hannah, and Dr. Tilton. On behalf of CNF and our communities, we are so grateful that you shared your time and expertise with us today, and we look forward to implementing what we learned tonight. So as a reminder, CNF and our partners have resources and transitions of care. We've shared them in the chat this evening, and they're also available in the password protected hub, which you all received when you signed up. We'll also be receiving an email, and there's a link in the chat that will include a survey. Please fill it out. We really, truly appreciate your feedback and your time. So feel free to fill that out as soon as you see it. We also would like to thank our partners, Acadia, Biogen, ASI, Genentech, Greenwich, and Zogenix. And we invite you, if you enjoyed our programming and you are able to give a donation. That'll be linked in the chat and then also on our website. So feel free to donate as soon as you see it. So this talk concludes the live portion of our 2021 Patient Advocacy Summit, but we will soon be posting the pre-recorded sessions on topics like advocating for nonverbal young adults, meaningfully using telehealth during transitions, and how patients can join payer advocacy on behalf of their providers. So all of that, and then all of the talks that we had over the past 2 weeks will be linked in the password protected hub. So thank you again for joining tonight. Thank you to our speakers, and we hope you have a wonderful weekend. Thank you. Bye-bye, everyone.
Thanks all. Bye-bye.